now? The answer may well define how you will be remembered. And remember this, I guarantee you, people like me doing this job all over this country will never let people forget who stepped up and who fell back. Now is the time. The challenge is great, the stakes are high, and you are aware. For me and my audience, there is only one direction, it's to take it on. So let's get after it. Chief Medical Correspondent Dr. Sanjay Gupta joins us now. You're finally hearing from the head of the CDC, what he should have been saying, frankly, for months. We get the politics, but, there's a time for bravery. He's now saying the darkest period in U.S. health history may be in the coming months. Have you ever heard anything like that? And how might it take shape?
Well, I haven't heard anything like that. He's comparing what is happening now to what happened 100 years ago. And, we're obviously a very different society now. We have ICUs, we have hospital care, we have vaccines on the horizon. And yet these death rates are approximating what we saw 100 years ago. And I think that's what Dr. Redfield is reacting to. What he's referring to are, these numbers, Chris. We've seen 1 million cases roughly a week of new coronavirus cases. So it's hard to fathom, and we know what trends after that, the hospitalizations, which are now over 100,000, and then a few weeks later, the deaths. We don't know where this is going to peak at this point. If you look at the IHME models, they say it peaks sort of the end of this year, beginning of next year. But the real question is, how long does it stay there then? How long does it plateau? And Chris, I got to tell you, I dug into these models pretty closely, and many of them are sort of contingent on this idea that there are going to be many statewide mandates that either stay in place or go into place over the next couple of months. If those things don't happen, because we're still not seeing them, the number of people that they project could die by March 1st is 650,000. So that just gives you an idea. I mean, it's like that boiling frog. I think we've become so used to hearing these numbers and the hospitalizations and hearing about ambulance systems that are starting to fall apart, and field hospitals in Rhode Island, high death rates in Wisconsin, surge capacity being overflowed in California. I don't know how you could describe this as really any worse, but I think what Dr. Redfield is saying, it still can get worse than this.
So he's making an appeal to public health officials all over the states to try to convince their residents. I don't think we should waste time preaching to the converted. There is really one basis of pushback for people. And you mentioned it early on as an opposite component, a reason for concern. People will say, hey, look, I get it. People are getting sick. Nobody dies. Nobody dies. Look at the death rates. Per case, per capita, it's so small. Yeah, 230,000, 250,000, 300,000. That's a lot. But, look at all the other things that we ignore in this society, Sanjay. Although they kill tons more people, and we don't do anything about those, cigarettes, booze. But now you want to shut down the whole economy and ruin everybody's life over something that barely anybody dies from when you look at it on a big scale. What do you say to that?
Well, they're wrong. That's what I say. First of all, this could be the second leading cause of death in this country as things are shaping up now. It could be that only heart disease would actually lead to more deaths. That's typically 600,000 to 700,000 people die a year of that in this country. This could surpass that, Chris, for a disease that didn't even exist really a year ago. So that's part of it. The other part of it is that the vast majority of these deaths are preventable. The vast majority, Chris. We've gone through this so many times now, comparing here in the United States to other countries around the world. They don't have things that we don't have. They don't have some therapeutic or a vaccine that we don't have, and yet their death rates are a minuscule fraction of what they are in this country. So therein lies the frustration. You're right. People die of other things. They die of heart disease. They die of cancer. They die of stroke. They die of trauma. All these other things. There's these deaths of despair that have lowered the life expectancy in this country even prior to this pandemic. But what we're seeing here is an unmasking of all these terrible things. We are a more vulnerable country because we have so many more pre-existing conditions and comorbidities. But it's an incredible source of frustration because the numbers that we show on the screen every day, they didn't need to happen, the vast majority of them. And I hesitate when I say that because I talked to so many of these families who've lost loved ones over this past year, and the last thing they want to hear is that their loved one died a preventable death. But what else can you call it at this point? These are stupid deaths, as the Doctors Without Borders call them.
Well, we have another.
That's what I tell them.
We have another big challenge. People see the vaccine as an unqualified good. I don't. I'm worried about the states making decisions. They're not going to have enough of the vaccine, even if they follow the criteria of who's supposed to get it, starting with hospital workers and then long-term care elderly recipients. But hospitals in what areas? What kinds of hospital workers? Which long-term care facilities? Is it going to be the rich ones? Is it going to be based on color? Is this going to be based on class? These are big choices that we won't really be able to monitor, with one general oversight. That's my biggest concern about something that everybody sees as an unqualified good. Am I getting it right or wrong?
No, I mean, you're absolutely right. This is going to be a resource-challenged sort of distribution process. I mean, this is something that everybody wants, or the vast majority of people want, and there's not enough. So how this is going to be handled is it's unprecedented what we're going through right now. I hope many of the things that you're mentioning in terms of the institutional structural biases, I hope they don't permeate into the distribution of this vaccine, but I think it's a very real concern. I'm curious to see what happens in the UK over this next week as they start to distribute the vaccine. Hiccups that maybe we couldn't even anticipate. But you're right. I will say this. The states are going to have to make some decisions in terms of triaging these vaccines. We know that. But healthcare workers across the board, there's 21 million in the various locations that we just put up on the screen for a second. Not all of them are the same in terms of their risk for COVID. I'm a healthcare worker. I'm a neurosurgeon. I don't primarily take care of COVID patients. I have colleagues who do. That's all they do. They're in full personal protective equipment all day in those intensive care units taking care of those patients. They're at the highest risk. So those types of triage decisions are probably going to be made not only at the state level, but at the institutional level, and perhaps even within these long-term care facilities as well. It's not going to be perfect, Chris. And there's also this issue of almost as quickly as this vaccine is being manufactured, it's going to be distributed. I mean, because there's such a tremendous need. If you get a batch wrong, because there's 20 to 25 quality control checks they got to go through before they're released, let's say one doesn't make it. Well, all of a sudden you're going to be even further behind. So there's going to be some stutter starts here, I think, for sure. And there may be some inequities that hopefully get addressed very quickly. But right now, as has been the case for the last 9 months, Chris, there isn't really a national leadership here. There's no national plan. People are sort of left to scrap and figure it out for themselves, beg, cajole, and plead for these vaccines, and then figure out how to best distribute them.
There's no way to do it, because what have we seen? The virus hurts the most vulnerable, and the system tends to not put them first either. But we'll stay on it. That's what our job is. We'll stay on it. Dr. Sanjay Gupta, thank you very much.
You got it.
All right, so the obvious became news again when Bill Barr came out to definitively say, as